IQ5 on your health today, reducing the risk of heart disease. There are new treatments and techniques. They're on the way, but which ones show the most promise? Here to talk about that is Dr. Jorge Plutzky, Director of the Vascular Disease Prevention Program at Brigham and Women's Hospital. Thanks for being with us, Doctor.
Great to see you, Doctor. So,
thank you.
Question one. You just returned, right, from a conference in Philadelphia where researchers discussed using a gene editing tool to lower cholesterol. It sounds very sci-fi-ish. How does it work?
Well, fairly recently, people were uncovered who, for genetic reasons, not because they were on a drug, not because it involved any kind of pharmaceutical company, but these were people who went through life with very low levels of bad cholesterol. And those people turned out to be completely normal. They were just protected against having heart attacks and strokes. And of course, the next step was, well, can we turn that into a therapy to treat other people? And we have, first with antibodies that you inject every 2 weeks, then with a drug that you take every 6 months that turns the gene off. But what was so striking at the American Heart Association meeting was the release of going in and actually editing the genes of 10 individuals who had very high cholesterol levels and had prior heart attacks, and being able to change it so that you had, as is referred to, one and done therapy, that you had converted things, taken out this gene, and resulting in very low levels of cholesterol.
That is a wow. Yeah.
It is. Right. We do know that the study is small. It was 10 people, but what are researchers saying about the potential impact really for millions of Americans?
Well, it's a first step. It's really crossing the threshold into a new era of the ability to modify one's genes to improve health. And so from here, of course, safety will be first and foremost, but the potential for this particular gene to be targeted, and then for us to begin looking at other genes that could be protective. I think it's just the start of a new era, and it's exciting to see, but we do need to know that it's safe and effective.
And Doctor, next question, we're also learning a new study about involving the weight loss medication Wegovy. Researchers say it is showing some big benefits for heart health. So I don't know if you can simplify or give a simple answer, but what does that mean? When we hear heart health, we get attracted to that. What does that mean?
Yes, well, that was quite a remarkable study. I was involved in that and a co-author of the weight loss drug Wegovy, given to people who had a very high risk for having heart attacks and strokes. They'd had them in the past, and who were also overweight and obese, which of course is a very common problem, but who did not have diabetes. We already know these drugs protect against heart attacks in people who have diabetes. These individuals did not have diabetes, and we saw a pretty remarkable decrease, 20% in heart attacks and strokes, despite the fact that these people were well controlled on their cholesterol and their blood pressure. So this was really just through the weight reduction, and it is, quite important.
Interesting. Dr. Plutzky, thank you so much for joining us on this Monday afternoon. We appreciate your time.
Thanks, Doctor. Great to see you.